Okay. Good evening, everyone, and welcome to Atp Pediatrician Live Monday. Welcome, everyone, and I'm just going to go to our Facebook group and make sure that I pinned all the videos. So, welcome to those who are joining me. Welcome if you are joining me from Facebook, Instagram, YouTube. You're welcome to Atp Live Monday. I am Gbemisola Boyede, and I'm going to be with you for the next 1 hour, answering any questions that you may have about the health of your children. And so, uh, while we're doing all the usual admin stuff, I just want to encourage you to share the video. I think I will do the same as well. Let's share the video to all our groups and invite your friends, invite family to come and join us. And then we can start to answer the questions. So, welcome. First Monday in October. Happy Independence in arrears to the Nigerians who are listening to me. And I'm just going to share the video. But if you have questions while I'm doing all my sharing, feel free to start to drop your questions. We have just 60 minutes to do all the question and answers. So feel free to start to drop your questions, whether you're on Facebook, on Instagram, on YouTube, whichever platform you're watching in the Facebook group, on the Facebook page. Please start to drop your questions, and I will also come back to answer them. Please, when you're asking your question, please start with the age of the child. It amazes me how many times I have to say that, like literally every day, and sometimes several times a day. But it's so important for us as pediatricians to know the age of the child. So please always start. Don't just say my baby. Even some of you call your 10-year-old or your 20-year-old, you still call them your baby. So, but for the pediatrician, we need to know the age of the baby, of the child, to be able to have a clear background, because the way we answer questions vary depending on the age of the child. Good evening, Major Evers on Instagram. Thank you so much for joining me. So the answer you get will be determined by the age of the child. So the same question, different age group, and you may have completely different answers. So it is so important. I can't overemphasize that you always start with the age of the child. Be mindful of the fact that I am not in your house, so I'm not seeing the child. So all my answers are going to be based on what you tell me. And so I need to always make sure I have the right mindset of what age group I'm addressing. And please try and tell us the specific issue about the child. We don't need the whole life story of the child, but what is relevant. Okay, so if you're asking us, for example, about the weight, your baby is not gaining weight, your baby is looking small, it is relevant for you to tell us the specific, maybe the birth weight, the current weight. Those are basic information that will be helpful for me to know. We like very specific information. We don't like when you girls give generalized statements. My baby is small, it's not gaining weight, or my baby is this and that, without my baby is always doing this. When you say always, what is it? Is it once a day, twice a day, once a week, twice a month? It's better to say my baby does this every day, or my baby does this once a week, rather than say my baby is always. So we all need to have facts and not just generalized statement. And then please ask us very specific questions. I know that seems like a redundant point to make, but it always amazes me how many times people just drop information and they don't tell me what they want me to do with that information. And I try as much as possible not to guess, because there's nothing as annoying as having gone ahead and thinking this is what the person is asking, and you've given a whole thesis on it, and then the person say, "Oh, that's not what I'm asking." So over time, I've learned not to guess or to make assumptions. I always prefer you tell me specifically what your concerns are and specifically what you want me to address. Um, so I think that is the summary, and I think at this point I've shared all the videos, and I think I've pinned it to everywhere. So I guess we are ready to start. So let me start again by saying welcome everyone to ATP Live Monday. I am Gbemisola Boyede. I'm a pediatrician, and my job this evening is to answer any questions that you may have about the health of your children in the next 60 minutes. This program is brought to you by Atp Pediatricians Foundation. At Atp Pediatricians Foundation, we are committed to the health and the welfare of all children globally, but especially in sub-Saharan Africa, Nigeria, especially where most of our children are still dying from preventable causes of dying. So we do that through our health education, information online, and we also do community medical outreaches. So that is a short summary of who we are and what we do. So this program, ATP Live Monday, comes your way every Monday, 6 p.m. Nigerian time, West African time, for just an hour to just do a live session. But if you have questions beyond Monday, of course, I know you do, you can always go to our Ask the Pediatrician Facebook group. That is one of our most important harm. So that Facebook group has been there for almost 10 years now. And what we do on that group is to answer any questions that you may have about the health of your children. Monday to Saturday, we are there 24/7. 24/6, I think, because we're not there on Sundays. So we're always there, and when you post your questions, we will always answer them. And please remember that it's a group. It's a support group for parents. It is not an hospital. It is not a replacement for your doctor. All of us still work in hospitals. We still see our patients there. So there, you will still need to come and meet us at the hospital when your children are sick. But we want to try and reduce the number of times you have to go to the hospital by giving this health information, health promotion, and also helping you to know what is urgent, what is not urgent, and more importantly about prevention, because we all know that prevention is always better than cure. So that is what the group is. I know some people get upset, they're like, okay, but you're a doctor and I've seen you in the group, I'll put my question in the group. Why do I seem to go to the hospital? Yeah, there are certain things I cannot do on Facebook, of course. I cannot examine your child. And there are some questions I'm going to ask you, which I cannot, it's not about money, pastor, fire, whatever, which I cannot ask you. There are certain things that have to be confidential. So some things cannot be done on Facebook, some things cannot be done online. We have to see your child face to face. We have to examine the child. If I need to put a line on the child, I'm not going to do it on Facebook. So if I want to take blood, I'm not going to do it on Facebook. So don't get upset when we say this child has to go to the hospital, because some things still need to go to the hospital. And so please, let's bear in mind. Let's bear that in mind. All right. So I think I've done enough announcements, enough information. Let me go to the first question. This is a very long one. Try and keep your question short, or otherwise we won't see everything. Try and just go straight to the point. Don't write too much. Abiola Oderemi is the first question I have on Facebook. Say my 5-month-old baby has been putting everything in its mouth, claw licking people's body when they carry her. I'm not comfortable with it. People say I should overlook it. Someone told me it's teething and the gum is itching her. Should I buy her Burna Babe or Baby Rex? Number one, I'm happy you're asking your question, but immediately you go to Burna Babe and Baby Rex, you just put it in another you introduce another dimension. So babies learn to put things in their mouth. Babies go through a phase, we call it the oral phase, where they actually experience the world by putting everything in their mouth. So there's absolutely nothing wrong with that. And babies, when they're sitting, they can bring out, they can bite on things, they can chew on anything you put in their mouth. That is also not normal as well. But please, your baby do not need any baby Rex or Bonababe or anything called that. So teething is something that is absolutely normal in children, and they do not need medication for it. Okay, so what you are trying to do is to make sure that in this phase that your baby is going through, where they want to put everything in the mouth, you want to make sure that the baby can do it in a way that the baby does not put themselves at risk, does not get exposed to germs. All right. And what we normally recommend is that you can give baby toys, soft toys, what people call teethers, to bite on or to chew on. There are toys like that because you can easily wash them, you can sterilize them, and you give it back to the child, and the child can use that to, to rub their gum or to bite on. And that is all the child needs. Sometimes you can even put them in the fridge so that it make it cooler. And when baby puts it in the mouth, it's kind of cools the gum. So that is absolutely fine, but not medication, please. Please do not give children any so-called teething drugs. Immediately you go to that, you already assume maybe it's teething, there might be need teething medication. No, but baby does not need any medication for teething. It's absolutely normal for baby to bring out the teeth, just the same way you don't give them walking powder or you don't give them sitting mixture. So why do you need to give them teething? Okay, so your baby is developing all the time. They've grown bigger than they were when they were newborn. They're going to also keep developing, and you don't go buy drugs for each of those things. So why do you need to buy drugs for the teething? Bringing out the teeth is absolutely a normal thing for babies to do. It is not a disease. It does not make them sick, and because of that, they do not require any drugs. So please do not give your child any medication. So you can give the child teethers, something soft toys. I'm sure you've seen most of them are available in all the shops selling baby stuff. That's all you need to put for them to buy on, and not medication. So Adbiola, I hope that is okay and you got that information. And then you say something about your baby's birth weight was 1.8. Was the baby born preterm? So if your baby was born preterm, you need to always state that, because I know and you know that the average normal birth weight starts from 2.5 kilos. So your baby's weight, if it's less than 2.5 at birth, you need to always let us know why, because that is absolutely not normal. But if your baby was born earlier than normal, then you need to tell us. The reason why that's important is that when we are looking at because you're asking me whether the 6 kilo is now normal for your baby at 5 months or not, I need to know whether your baby was born preterm or not. Because if your baby was born earlier than normal, I need to adjust for that. So for preterm babies, we normally adjust their weight. And it's not enough for you to say baby is preterm. You need to tell me how preterm the baby was. How many weeks was the baby when you had how many weeks was the pregnancy when you had the baby? Because that is the information I need to calculate what is your baby's corrected age, and then what the weight should be for the corrected age, not the chronological age. Because I'm sure this 5 months you've told us is the chronological age of your baby. So if that's the chronological age of your baby, you need to tell us how many weeks your baby was when your baby was born, so that we can now calculate the corrected age of your baby. Because your baby's development, weight, growth, and development will be measured compared to their corrected age, and not the chronological age. So for mothers, let me just give this as a general, but for mothers of preterm babies, anytime you're asking questions about your baby, always starts with the fact that my baby was born preterm at 30 weeks, 32 weeks. That information is so vital for preterm babies, because everything else hints on that information. So because of that, I won't be able to answer your question, because I don't know whether your baby or how early your baby was born, and so I won't be able to calculate the corrected age, and I won't be able to tell you whether your baby which is okay or not. So I believe you're still listening to me. Just tell us the um the gestational age of your baby when your baby was born, and the information that baby last month was 6 kilo. That's also information is also not appropriate. Just tell me how old your baby was when that weight was measured. At 4 months, the weight is 6 kilos. That is more relevant than last month. I'm not sure how many weeks ago was last month to today, so it doesn't really help. So because maybe it's 5 months old, I guess today. So I don't know whether last month was the last month beginning or last month the middle, last month the ending. So you understand. So, but for a pediatrician, what matters to us is at 4 months, my baby at 14 weeks, my baby weighs 6 kilos. At 4 or 16 weeks, my baby weighs 6 kilos. That is the most um appropriate way to give us that information. So I hope that is helpful. So just tell us that and I will address the rest of your question. But please, no teething powder. And for those who are listening to me, no teething powder. Okay, let me come back to Instagram because Instagram questions tend to run off before I catch them. So Major Evers is saying, what a mother eat affect a baby that is breastfeeding? Of course, the answer is yes. Everything you eat goes into the breast milk. Why do you think we tell breastfeeding mother not to just take any medication? Because everything goes into the breast milk. So there are some medication you cannot take if you are breastfeeding. So because it can go into the breast milk and it can affect your baby. For example, a very popular one which people do so flippantly is taking tetracycline. I'm having diarrhea, just go and take tetracycline. If you are a mother, you are pregnant, you're breastfeeding, you should never take tetracycline because that tetracycline is going to go into your breast milk and it's going to go into your baby's body and it's going to cause what we call permanent brown staining of the teeth of the baby. It gives this greenish brown staining and it is permanent. So we don't expect you to take, don't just say, I'm having diarrhea, I'm just going to go and take tetracycline. Don't do it. And anytime you are going to the hospital and your doctor is going to treat you and you are breastfeeding, you must always tell them, I'm breastfeeding, I'm pregnant, because then they will know which drugs not to give to you. And before you take any drugs, you are breastfeeding, you are pregnant, even for everybody, but at least more importantly for those who are pregnant and breastfeeding, please read the leaflets. The number of times people come and ask and say, oh, I've taken the drugs, then I now read the leaflets and I'm now worried. I mean, the number of times people ask me that question is just so amazing. Please don't do medicine after death. I mean, how do they say that expression now? Please read it. There's no emergency in taking any medication. Every medication that's an emergency, you will be in the hospital. We will be somebody else will be giving it to you if it's an emergency. So, but any medication you are taking in your own house is not an emergency. So there's no rush to give medication. You must always read the leaflet first. You must always double check the dose second. You must do all that before that drugs go into your mouth or into the mouth of your baby. So it's so important for us to get that. So it's very important. Whatever you eat affects your baby. Okay, and more importantly, when it comes to drugs, so you are saying eat bread a lot. My in-laws say to make it difficult for the baby to poo. That is not true. That one is a different thing. So eating bread a lot does not mean your baby will now become constipated. When you eat bread, your baby is not going to eat bread from the breast milk. Your baby is going to eat the digested bread which is going to the breast milk. So that is not the issue. But things like flavors, for example, some people take certain drinks or certain flavors, and it can go into the breast milk and make the baby uncomfortable. But the fact that you eat bread and your baby becoming constipated, that is not true. That is myth, or what we call false stories. And I think you've asked this question before about your baby being constipated, and I've already explained that babies on breast milk, they not passing stools every day does not mean they are constipated, and it does not mean they are struggling to pass stools, because when they eventually pass their stools, the stools will be a normal stool, and that is not constipation, and that is not struggling to pass stool. All those sounds baby makes does not mean they are struggling to pass stool. It's just some sounds that baby makes. Brain Grace Ambulance, Dr. Gbemisola, thank you so much for joining us. All right. Okay. Let me go back to Facebook. If you still have question, please ask. Okay. The next question I have is about Ojope. Good evening, doc. How long will it take for my baby to stop having colic? Okay, most babies have colic till about 3 to 4 months. About 4 months, most of them will stop. There's no law. Most of these things is not like written in iron or something. So everything is arranged. When we say most, we say averagely most babies will stop having colic by 3 to 4 months. Now, that having said that, I noticed a lot of mothers always assume everything is colic. So even when the baby is 5 months, my baby is still having tummy pain with colic. No, don't always make assumptions, okay? And many people also don't know what colic is. So when we say colic, this is a baby who is crying, number one, for no reason. Number two, the baby is not wet, the baby is not hungry, the baby is not cold or hot or any of those things. Otherwise, well, baby, everything is fine, but baby just cry maybe for a few hours every day, and then they will stop. And that's actually the definition of colic. We don't know why we have colic and all that. It's just a passing phase and it will stop. So you need to know which one it is. So it is not everything that is colic. So let me just quickly chip in that. You said she grabs me so tight at times, and that gets me worried. I'm not really sure what you mean by grabs you so tight. I don't know. That is not the definition of colic. So you need to really tell us what the baby is doing when baby is grabbing you and all that. So baby trying to pass through, baby making urine, baby passes, baby crying. What is your definition of? So that's just saying baby grabs me so tight does not bring any alarm bell for colic to any pediatrician. You need to be very, very specific about that. All right, let's move on. Still don't have any question on Instagram, so I'll continue. Stella Clemens, good evening. My daughter of 2 years can only say mommy, fine, come, fun. Hope it's not something to worry about. I usually don't like to say anybody should worry about anything because worry does not solve any problem. But definitely your child's speech development is delayed. A 2-year-old should be combining 2 words together. So that is the minimum we expect from a 2-year-old. I always teach parents the rules of the thumb. Rules of the thumb means age 1-year-old, single words. So all you said now is single words, and that is a 1-year-old level. Age 2, they should be combining 2 words together. Mommy, biscuit. What I'm just trying to give you examples. 2 words together that is meaningful. And age 3, they should be speaking in sentences, 3 to 4 word sentences. A 4-year-old should be able to speak, and a complete stranger should understand a 4-year-old speaking, complete with grammar and everything. That is what we expect for a 4-year-old. So that is the usual. So if your child's speech is a little bit delayed, I will recommend that you see a speech therapist. Many people come to us as speech therapists. We have speech therapists in Nigeria. Just Google, thank God for internet, Google speech therapists in my area. Hopefully you will see 1 or 2, and then you can go check them out, and then they can advise you further on evaluate your child, because sometimes parents, we tend to focus on the what we call expressive speech, what the child is saying. But when we professionals see the children, we are looking beyond what they are saying. We are looking at their understanding. We're looking at their social interaction. We're looking at their play. We're looking at their behavior. All these are very important. A lot of people will come to our online our what's it called, our WhatsApp number, and they will say, I want to see a speech therapist, and I always ask them, just give me a short summary of why you want to see the specialist first before we put you to the right specialist. And 9 out of 10, most of them don't even need a speech therapy because the child has more issues than speech therapy. This child is not sitting, this child is being repetitive, this child is doing this. It's not just the talking. That is not speech therapist. That is a developmental pediatrician needing to do a full assessment on that child. So what I normally do is I say, go screen your child. We have all these M-chat for autism screening available online for free, and it will tell you what your child scores. And based on the score, it will tell you your child needs to see a pediatrician for an assessment, or there's no problem. So if the child is just only speech delay, that is a speech therapist. But if the child is also having other behavior issue, they are not giving eye contact, they are not playing with other children, they are not, they are doing certain things repetitively, they are having tantrums, meltdowns, we need to screen them for autism. We may need to do an assessment for autism. So everything is just rise and fall on just the talking. And that is why it's always important to see the specialists, because they are the ones that can give you that assessment. And the way we see the children is different from the way you will see them as a parent. So please always see the specialist. And for children, the earlier the better. So the earlier we start all this intervention, the better for the children. All right. So okay, Abiola Oderami, so your baby is 34 weeks. You didn't tell me whether that weight was taken when your baby was 4 months or 5 months. So I'm just going to assume it was taken at 4 months, which is 16 weeks. But your baby is 5 months, and you said last month. So if you are still listening, it would have been best for you to tell us this weight was taken exactly the number of weeks your baby was when it was taken. So if your baby was born at 34 weeks, your baby was born 6 weeks earlier than normal. So we have to subtract that 6 weeks from your baby's current age, or the age at which that weight was taken. So if I'm subtracting from, let's say, 5 months, 5 months means your baby is 20 weeks. So if you subtract 6 weeks from that, that means your baby is actually 14 weeks old. That is what it means. But if the weight was taken last month, so it means I've been taken when your baby was, maybe your baby was 14 or 16 weeks, that means your baby was actually 10 weeks old when that weight was taken, or 2.5 months old. So let's work with the fact that your baby was 2.5 months old when that weight was taken. That means your baby weight was 6 kilos at 4 months. In that case, your baby is now, so most babies will gain an average of a 1 kilo per, on the date of birth. But if we calculate that, there's a formula we use, but there are other many methods of that. But an average 2.5 months old baby should be weighing, depending on how they start. But let me just calculate it using the normal formula: 9 plus 5, 11. Yeah, they should be weighing about 5.5 or thereabout. So if your baby is weighing 6 kilos, that weight is okay. That is normal weight. And so I'm not worried about the weight of your baby. So the weight is okay. But remember that I've made a lot of assumptions because you have not given me all the information you need. So if you're still listening, you can just put in all the information, and I can work out everything for you perfectly. All right, but I think your baby's weight is okay anyway from the little thing I've done. Okay, Rosemary is asking, please, can I give my baby vitamin A vaccine myself at home? You can if you have it. But please, the vitamin A vaccine we give in the hospital. How old is your baby? Mhm. The weight of the baby, the age of the baby is always missing. The age of the baby is the most important information. Rosemary always starts with the age of the baby. Anyway, what I was going to say is that the dose of vitamin A we give in the health center is a high dose. It's not usually sold in the pharmacy. The pharmacy sell very low dose vitamin A, but we give like 50,000 because that's those we give in the health center during immunization, whatever, is supposed to last for 6 months. Luckily, vitamin A is one of those what we call fat soluble vitamins, if you remember your biology. So, fat soluble vitamins that if we give it, it doesn't get passed out in the urine. The body actually store it in the fat. So when we give you 50,000, it will stay in the body and will be enough for the next 6 months. So that's the idea. So, but most of the ones they sell in the shops, they are usually maybe most of them are even less than 12,500. So you always have to check what is the unit of that vitamin A. So for babies less than 6 months, for babies 6 months and 1 year, we give them 50,000 units. For babies between 1 month to 2 year, 1 year to 2 years, we give them 100,000 units. And for babies above 2 years, we give them the 200,000 units. So if you are going to give the vitamin A by yourself, you have to look for those that comes in those units. Okay, and usually I think the 50,000 one is blue, and I think one is red. We have it like that. So you really need to be sure you are giving the right amount, because if you have to buy the ones in the shops that are smaller, it means you will take so many of them to get to the units we give. So but if you get the one we normally give in the it's like a capsule and it's like oil, you just open it and squeeze out the oil into the mouth of the child. So it's very small and so many units given at once. So just go back to your health center and ask them for the immunization when they are going to have the vitamin A. I'm not so sure you're going to have the appropriate dose in the in your pharmacy. But if they have, ask them if they have the, yeah. Sometimes in Nigeria, anything is possible. People can find anything. So if they have the appropriate one, why not? You can buy it and give it. It's an oral thing, and we give it every 6 months to children at 5 years old, because vitamin A is one of the most easily preventable cause of blindness. I mean, why should a child have blind eyes from something we can just cure with a drop of oil? So that is why we always give vitamin A to children. And it's so amazing how many of our children have vitamin A deficiency, and then they have what we call night blindness, and they actually, when they can go blind. It's very, very sad that children should go blind from something that is so easy. And that's why these days, even the government is recommending that all our butter, all our flour, things that people use a lot, is fortified with vitamin A. So you will see the picture of an eye. Anything you see a picture of an eye written on it, whether it's your sugar, whether it's your butter, whether it's your flour, with a picture of an eye, it means it has been fortified with vitamin A, because there's no reason why any child should go blind because of vitamin A deficiency. So that is about that. All right. Let me come back to Instagram for the question disappeared. Temil, my 2-year-old has eye wax. Eye discharge, you mean? We don't call wax. We use wax for the ears. For eyes, we use discharge. Okay, she wakes up with her eyes glued together. Yes, eye discharge. Please, can I apply eye drop on it? What eye drop are you going to apply on it? Because you need to know what you're going to apply. So don't self-medicate, okay? We don't want parents self-medicating. So what you can do as a mother for your child who is having eye discharge is to get clean water, clean cloths, maybe handkerchief or face towel, and just clean off the discharge first thing in the morning. If you clean off the discharge and it happens again during the day and it's yellowish, because most of us have this eye discharge in the morning, it's whitish, that is normal, that is not a problem. But if you have yellowish eye discharge and the eyes are glued together, you clean it during the bath in the morning, or just clean with clean clothes and water, and the eyes keep bringing out discharge, whether the eyes is, whether they are red, whether they are itchy or not, that is most likely an infection, what we call bacterial conjunctivitis, whatever. So it's an infection in the eyes. You don't need to worry about the medical jargons. You need to take the child to the hospital. It's only a doctor that should prescribe the eye drop for you, okay? There are lots of things that goes into all this medication we prescribe, okay? A lot of parents just use chloramphenicol anyhow. Chloramphenicol can shut down the bone marrow of people, okay? That is how dangerous it can be. So, and so many other ones, gentamicin can damage the kidneys. So there are issues with all these drugs. So we are very careful, and that is why you need to get this prescription from a doctor who will know that this is appropriate. And they need to also check that your child is not allergic to this drug before this. All these issues are very important. So you have to see a doctor. Let them prescribe the medication, appropriate one for you. And they will tell you, use it for 7 days, use it for 10 days. Please use it for the number of days. And when you're applying eye drop, there's a way to apply it. You should not be touching the dropper into the eyes, because if you do, you're actually contaminating the eye drop itself. And so the discharge is not going to go, because even what you're applying now is already been contaminated. So these are all important information. This is why you still need to come to see us in the hospital. Don't just go and buy eye drop. And so please tell me, you have to see a doctor and let them sort out your baby's eyes. And sometimes we have to take what we call a swab. We'll take a little bit of that discharge and send it to the lab. And then the lab will tell us this is a particular, because sometimes we're just thinking, okay, maybe it's a common, the common organism or the common germs, but sometimes it is not. But if we have taken a little bit of the swab and we've sent it to the lab, we will start treatment before the result comes out from the lab. But the lab may come out and tell us that medication you are using is not going to be effective because the bacteria or the germ is resistant to it, but use this one instead, use that one instead. Then we're going to change our treatment. This is why it's so important for us. And that's why some of us will do all this. You just give any eye drop you like in your house, and it won't get better for a long time, because all these other extra things that doctors will have done, you won't be aware that you need to do all that. That's why it's important for us to go to the hospital. So please, tomorrow, or if you can still go today, take this child to the hospital. Let them examine the eyes. Let them take a swab. Let them start the treatment and follow the management recommendation of your doctor. All right. Okay, Major Evers is asking another question. Please, can you talk about autism? Yes, I've definitely talked about autism a lot. So if you want to listen to some of these talks I've done before, go to our YouTube channel, go to my podcast, Ask Dr. Gbemisola podcast, go to our website. All of them have been, so you can watch those videos again. So I'm sure we'll spend hours before talking. Every April 2nd is Autism Awareness Day, and every April I will do a complete talk on autism, and I'm sure I've done every April for the past 10 years. So you may want to go back and just watch one of them. Today I'm just going to answer because if we start talking about autism, we will not leave here today. So just go listen to some of the ones that we have done in the past. You say a child who is 5 years old and doesn't talk, seclude himself, okay, always with, yeah, the child may have autism. I'm not saying that's what the child has, because there are other developmental disabilities. So it is the job of pediatricians to now do a proper assessment and confirm whether the child has autism or other developmental delay, or even the two of them together, and then they will advise parents. So please, if you know the parents of this child, I will recommend that you ask them to see a developmental pediatrician for a proper assessment. And this child may already been assessed, and the parents may know that already. Well, that is something that can be done. But if you, for your own knowledge, please watch. Just go to our YouTube channel, or even on this Instagram, just type autism ATP. I'm sure all the videos will come out, and you can always watch them. All right. Okay, let's go back to Facebook. Jane say, when you try to carry her up, she cries so loudly and grabs you like she's in severe pain. When you try to carry her up, okay, there's a lot to unpack in what you said. So what I really want to know, was the child crying and you were trying to carry the child up to console, or the child was just lying down on her own and all that? So really, if you carry children up, depending on the way you carry them, if you are carrying the child in a way that the child feel like, I'm going to fall, I'm going to drop, it is natural for the child to, it's a reflex for the child to grab onto something to protect ourselves, because some of us will just take babies with one hand or something. So you must, when you're carrying children, you have to be also gently lift them. Don't just take them, because then the child is going to react, which is a normal reflex, which is a protective reflex. So that doesn't mean there's anything unusual about that. And all you need to do is just to comfort the child. And I don't want you to start getting unnecessarily overworked or overwhelmed or thinking there is more. Children cry all the time, and when children are crying and they want to hold tight to the parent, there's absolutely nothing wrong with that. It doesn't mean the child is in one severe pain that they have to go to the hospital. It depends on the scenario. So sometimes some of these things are best seen or not. But if you think your child is crying and you are not thinking whether it's colic or not, you are worried about something else, especially if you're a first time mother, just come to us. We will see the child, we will see you, and then we can reassure you, and everybody will be happy. So if you are worried, just see a pediatrician, no worries. But because I just want to be sure you are, obviously I think you're worried about that. Okay, Abiola Haderemi, okay, fine. Your health not to display to born at 4 weeks, okay, yeah. Okay, so she was 16 weeks when she was 6 kilos. Okay, so if she was 16 weeks, I think I answered the question correctly. Yeah, so the weight is fine. That is absolutely spot on weight, and the baby's is taking enough breast milk, because I think you asked a question about, it's as if baby is not sucking as much. One thing we need to realize that when you first have your baby, they are learning to suck just like you are learning to breastfeed. So both of you are learning with each other. All right, so after a while they get bigger, 5 months practice, baby become more experts, they are more efficient in sucking. So they tend to suck less, not because they are sucking less, it's just that they are taking the breath faster, because they are now, their jaw, their sucking power is more effective. So within what normally would take them 20-30 minutes before to do, they can do it in less than 10-15 minutes because they can drain your breast quickly. And if you're a very observant mom, you will notice that your breast goes empty so quickly. So babies don't need to spend as much time on the breast they at 5 months like they would do on the breast when they were 1 week old, because at 1 week they are still soft. They also, they don't have as much grip, they don't have as much strength, but now they are bigger, they are more efficient in sucking. So that is why the most important, the most objective evidence that a baby is getting enough breast milk is their weight. That is what we pediatricians use. It's not by mom saying, oh, my baby used to suck 10 hours, now he's sucking 3 hours, or my baby used to do this, or my baby used to finish this. No, the most efficient or the most objective way for us to know whether your baby is getting enough milk or not is the weight of the baby. A baby who is not getting enough milk will not gain weight. No, that is it. So no matter how the other ceremony, the most important thing is that weight. That's why every time you come to us, we put your baby on a scale. We must weigh the baby, because that tells us this baby is, as long as the baby is getting enough breast milk, that weight will be going up. But if the baby is not getting enough milk, no matter whether the baby is staying 10-20 hours on the breast, the weight will always tell us. So the weight will always tell us, and then we'll know that, okay, baby is not getting enough. So going by the weight of baby, 6 kilos at corrected age of 2.5 months, baby's weight is fine. So your baby was 16 weeks and you gave birth to, so I subtract 6. So that's 10 weeks. The baby is actually corrected age is 10 weeks, which is like 2.5 months. That is lovely. So I'm not worried about your baby's weight. All right, Stella is saying your baby, she understand everything. She can mop the floor when she pee on the floor. Okay, good. If you are not worried about your baby, that's fine. Okay, you don't have to do anything. But I'm just saying, from what you have told me about the expressive language of your baby, and I'm comparing it to what I expect for your 2-year-old, that language is delayed. Some people are just a little bit slower, and then they will catch up later, and that is fine. However, some children are actually telling us there's something wrong. Okay, so the way we work these days is not to, we don't work by what we call diagnosis. In other words, oh, this child is just a little bit slow, and then we'll catch up, or this baby actually is having a diagnosis or maybe autism or global developmental delay. The way speech therapists and most of us developmental pediatrician work now is, it doesn't matter what is causing the problem, just deal with it. If we dealt with it, it's better to deal with something and later find out that you are over, you overdo, like we say in Nigeria. It's better, because we have not lost anything, than for us to assume, oh, it is just, it's just, which is what people tell Nigerian mothers a lot. Don't worry. Some people say, my baby didn't even talk on the 3 years old. Mine didn't even talk on the 4 years old. That's what neighbors always tell mothers. That is a wrong approach. Okay? Because I will not end up seeing people like the one Major Evers was talking about, who are 5 years old, who were not talking. And we've mixed what we call the early intervention period. Early intervention is 0 to 5 years. That is when the brain is elastic, it's plastic, the brain is still developing. Anything we put into that brain at that time is better than for us to wait until. That's why children learn language. You see, children, they can learn 3 languages at once, because their brain is so plastic at that age. Whereas you as an adult, for you to learn one new language now, it will be taking you forever, because your brain has stopped growing. So it's efforts, So that is exactly. So we always take the age below 5 as early intervention period. We don't care whether it's just, the child is just a little bit behind, or there's actually something wrong, we give intervention. So for me, I would say, if you're worried enough to ask the question, then I would recommend you see a speech therapist and let them see. If they see the child and they now told you it is fine, you will be more reassured than for you to assume it is fine. Then maybe somebody later say, oh, I wish you have come to us 2 years ago, or something like that. So that's the point I'm trying to, I hope you get the point. So the point is that we don't even care whether it's going to be normal delay or whether it's actually something wrong. We just want to intervene as early as possible when the brain is still so plastic, when all our intervention are going to make much difference. So I hope that is helpful. I don't want you to, because I'm not seeing your child in full, so I'm only working by what you're telling me. So some of the answers I give may be over the top for you, maybe under the, but I just want you to be able to have that understanding of why I'm concerned. I hope that's helpful. All right. Okay, let's move on. Rosemary, so your baby is 7 months old today. Weight was 3.4. Okay, so your baby is seven. Okay, and that's you're the one asking vitamin A question. So your baby should be on the 50,000 units, I think. Yeah, well, we see, yeah, I think 6 months to 1 year, yes, 50,000 units. So if you're able to get that, you can go get it. So that's what it said. The pharmacist said it's four of it that okay, so you most likely your pharmacist have the one of 12,500. Check the dose because vitamin A can be overdosed. Vitamin A can be overdosed. So please check the dose of the four of each of them first. Go and check it now. If there's no dose written on it, don't give it to your child until you know what its dose is. Because vitamin A can be overdosed and your child can have what we call hypervitaminosis A. It's a disease. Please. So you have to be careful because like I said, vitamin A gets stored in the body. It doesn't go away. It will be in the body. Even though we're saying vitamin A is good, too much of everything is bad. So too much of vitamin A can cause problem. It can cause what we call raised intracranial pressure, pseudotumor cerebri. That can cause some other problems. So please go and read about vitamin A, too much of vitamin A before you start giving it at home. That's my main worry about it. So make sure you and your pharmacist, you have clear conversation on how much your baby is going to get. I don't want you to go and give too much and then you end up looking for the trouble that is not lost. So please go and check first. That's very important because unlike if you give too much of folic acid, too much of vitamin C, your baby will pass urine. Everything will come out in the urine. Too much will go out. But vitamin A is going to stay in that body till everything goes out. So you have to be very careful that you need to know the right dose. So I don't care what the color is because it depends on who is making it, but the most important thing is that you know the dose. So go and check the dose written on it and then you can come back and tell me. So I need to be sure of that first. Yeah. All right. Yesterday, Ogbede. Good evening, doc. I want to know if I should be concerned about my 8-month-old who said it's always warmer than the other part of his body. Just get a thermometer, check the temperature because most of these head is always warmer because the brain of the children are working, they are sucking. So the part of the head, the part of the body that is working is always going to get more blood flow. It does not necessarily mean there's anything wrong with the child. The most important thing is for you to check its thermometer, check the temperature. If the temperature is more than 37.5, that is fever, no matter what you feel. But if it is less than 37.5, that is normal and there's no reason for you to worry. And it's also not gaining enough weight. What is the current weight? Birth weight is 3.9. Current weight is 7 kilos at 8 months. So an 8-month-old should be weighing at least 8.5 kilo. So your baby's weight, and your baby was actually almost 4 kilos at birth. So your baby was almost 4 kilos, which is your baby was already on the big side. So obviously something is wrong here because your baby has not yet even double. Your baby should have doubled the birth weight at 5 months. 5 to 6 months, you double their birth weight. So if the baby doesn't double, at least minimum we expect the baby should have double. We should have at least would have been 7.8, right? Yeah, but an average 8 months old should actually be 8.5 as well. So I'm concerned your baby is not getting enough weight. He's eating. What is baby eating? So parents always like to say my baby is eating. Pediatricians, we are more concerned about what the baby is eating, not that the fact that the child is eating. What goes in? Is baby still sucking breast? Is baby having complementary feeds? How much quantity? How much frequency? Is there protein? Is there fat and oil? Or is it only just cereals? We're giving this child cereal and milk. So we need to know what exactly the child is eating. So when we ask this question, we want you to tell us in the last 24 hours, what has the child eating? We call it 24-hour meal recall. We want to see how often, what quantity. So those are more important to a pediatrician and my baby is eating. Baby is eating, no doubt, but is baby eating enough? Is baby eating the right quantity? Is baby eating the right quality? Is baby eating how many times enough? Is baby eating the right volume? So that is more important yesterday. So I don't know whether you need to give us that information first, or better say, you may want to see a dietitian, or you may want to see a pediatrician, somebody who can actually sit with you and go through the what the child actually eats and how often, and I hope you're still breastfeeding and all that. And then if we are able to rule out the fact that baby is actually eating well, then we need to now know if baby is eating all the enough food and enough calories, enough variety and everything, and the child is still not gaining weight. Then the question is why? Is there a problem? Is there something medically wrong? Is there what is going on? So then we'll look at that. But the first thing we need to follow check is that the baby is actually getting enough food. So we need that information. That information that baby is eating is not enough. We need to know what exactly and how often this baby eats. So that is that. Okay, you say your baby's temperature is 38.1. That is fever. So your child has fever. And if your child has fever, the question is what is causing a fever? And you need to go to you need to give paracetamol and then keep checking again. If the temperature keep rising, then you need to go to the hospital. They can do tests, blood tests, to know what is causing the fever, and then they can treat the child appropriately. And please make sure you're also not overdressing the baby, because sometimes these children have fever is from the mother. There's nothing wrong with the child, but we wrap them as if I don't know, as if they're on Eskimos or whatever. So please, let's dress our babies according to the weather. When it is cold, let's wear extra layers. When it is hot, let's remove the layers. Let's wear light cotton dress. Let our houses be well ventilated. Please, it's okay for babies to use AC. It's okay for babies to use fan. It's not written in the constitution that babies should not use fan. They should not use AC. Please, just make sure the room is put it on auto. Make it, the right just what is normal, it's not too cold, not too hot, just appropriate. And if your child is still having fever in that setting, yes, you have to take the child to the hospital for proper evaluation, and then you can take it from there. All right, let's go to the next question. Felicia, Facebook, today is Facebook people, because last time it was Instagram. Today is Facebook. Facebook didn't allow me to take a breath of so okay. So Felicia is saying thank you for your effort. First time mom. Okay, welcome FTM. My daughter of 15 weeks, birth weight 2.5, current weight no. Always scream and cry at night as if she's afraid of something. How old is baby? 15 weeks, so that's 3 months plus. Okay, should I be worried? Why you say baby is are crying at night? Babies usually can be crying at night anyway, normally. But the question is, babies awake, crying, and why is child crying? Because you need to have the setting right. Most babies at this age tend to sleep more during the day, and then they are more awake at night. We all know that. I hope you know that as a first time mom. So that is number one. So there's nothing wrong with baby even being awake at night. And then when baby is awake and not crying, why? Is it that this baby is hungry? Is this baby wet? Is this baby hot? Is this baby cold? Is this baby nappy wet? Does the baby need nappy change? Because the only message, the only communication that babies have at this age is the crying. That's the only way they let you know something is wrong. So it is now our job as the mother to figure out this cry, what is wrong? Is the baby just bored? Does baby just want somebody to play with, like the mother? Maybe you are sleeping and baby just want you to have a look at her, hold her or something. So you don't start getting into all this superstition, like my baby is crying, something is making up, but there's nothing scaring the baby at night. The baby is not seeing any witch or wizard, so don't even go into that direction. It is okay for a baby to be awake at night, and it's okay for them to cry. So it is not because they are not seeing any ghosts, they are not seeing any demons. Don't get into that. Don't let anybody start to make you fear or there's something wrong with your baby. Your baby does not need any difference. So the question is, why is your baby crying? So what we need to figure out is the why. So what I would normally recommend is that when you start to cry like that, you have to do all this triage. Breastfeed the baby first. The baby hungry, give breast. Let's see whether that will take care of it. Check the nappies. Is it wet? Is it dirty? Change it. Okay. Check the room hot. Is the room cold? Is mosquito biting the baby? There's so many things. So just make sure you for triage all those things. Some people even have colic, because it's still the age of colic anyway, between 3 to 4 months. They may still be having colic and they just cry, and it appears they are crying for no reason. All you need to do is just to, hold them, comfort them, and all that. That is what, like my mom would say, that's what they call abiyamo. That night's not sleeping, that means to take care of your baby. That's actually what it means to be a mother. So you do all that and see whether your baby is able to sleep. Okay, but if you do all that and baby is still always crying and you can't still figure out what is making the baby to cry, and you've done all your usual thing and your baby is still crying and you're worried, then you can come and see us in the hospital. Okay, that is why the pediatricians are there, because some children may actually be sick, because sometimes when babies also cry for no reason, it's also that they are sick. But you must have made sure all the other things have been taken care of. Most babies, when you do all the other things, they actually go back to sleep and they are fine. But if there's something more, even when you cuddle them, you try to breastfeed them, everything will not work. Then you may think, oh, is there something else going on? And that is when you come and see us at the hospital. So I hope that is that. Then secondly, she stretches throughout the night. Even when you mean stretch, it's okay for people to stretch. It's okay for them to move their body. They are not supposed to be still like statues. I know mothers ask that question a lot, but it's okay for people to move their hands and move their legs. When anything going through their body, the gas is passing through. They want to pass gas. They want to wee. They want to pull. They move their body because they can feel something is coming out, and that is perfectly normal. That doesn't mean there's anything wrong with them. Okay, so it's not like us that some of us will sleep, some of us will move our body in our sleep. But I know most of us we can sleep like a statue, but it's perfectly okay for babies to move. All right. Exactly. I've not even read I've not read the end of your question before I've already answered it. But exactly, so your baby wants to pull, and that's why they move all the. But and that is perfectly fine. You see, that is exactly what I was talking about. So there's nothing wrong with the baby pulling after breastfeeding. That is also perfectly normal. She's exclusive breastfeeding. Okay, so yeah, you're a first time mom, truly. So all those are first time moms questions, and all of them are fine. There's nothing wrong with your baby. Just keep breastfeeding. If your baby is crying, just cuddle them, pat them on the back, all that, and they will be fine. All right. Okay, let's move on. My time is almost up. I got 4 minutes left. Okay, but I hope I will answer this question. Okay, so yesterday say your baby is on 40 pap cereals, pap 45 with groundnuts, soya beans, debbie nuts, tiger nuts, unripe plantain, potato. I can't see much of your protein here. Apart from the granules, I don't see the animal protein. I can't see the crayfish. I can't see the fish. I can't see the egg. I can't see the meat. I can see like a little bit of oil, maybe a little bit from the granules, maybe. But you seem to do a lot of more of the cereals and less of the protein. So maybe you need to add that. Okay. Potato. So most of what you are listing, the cereal, the pap, the potato, the plantain, they are all carbohydrates. So we want you to add a little bit more of the protein. So please add, at least give your baby, even if it's just one boiled egg a day, or you can break the egg into the pap. Make sure you still breastfeeding. You can blend your crayfish, add it to your maybe like your, and I can't see much of veggies as well. So maybe your ewedu or your okra and all that. So do more of that. Your Titus fish, add it to some of those things as well. So there are many things you can see add. I think that's so. If you're on our Facebook group, go to our Facebook group. Ask the Pediatrician Facebook group, go to the guide session. In the guide session, we have what we call the guide 2 or 102, whatever, on complementary feeding. Because what we did there is to break down. So when we talk of food, we have about what we call 5 food classes. So we have the energy giving food, carbohydrate, and the rest. Then we have the protein, body building food, and the protein, we have the animal protein, we have the plant protein, and then we have the fat and oil. Then we have, of course, our the fat and oil can be your butter, can be your palm oil, can be your granite oil, all those oil. Then we have our dairies, your yogurts, milk, which you have all those ones. And of course, we have our fruits and veggies, the welfare food. So fruits, vegetables, all those are so important. So I can say you have a little bit of the carbohydrate aspect covered, but I'm not seeing so much of the protein parts coming out. I'm not seeing so much of the fruits and veggies coming out. So I want you to add all that. And that's one. Number 2, the frequency of feed. So you see your baby 8 months old or 7, I can't even go back. So this baby should be eating at least 8 months old. Yeah. So your baby should be eating at least nothing less than 3 to 4 times a day. Yeah. So to 6 to 8 months, 2 to 3 feeds, and from 9 to 12, they should be having like 3 to 4 meals. So, but because your baby is already 8 months and you're worried about the weight, so I'm going to recommend at least 4 feeds a day and 2 snacks as well in between. And your baby should be taking nothing less than 3/4 of a cup, So there is, when we say a cup, that's about 150 mils. So for 6 months old, we say half of it, but this your baby, it's 8 months old, you can make it 3/4. So that's about 100 or thereabout. So if you're making pap, or if you're making any of those things, it should be like at least 100. So she should have it like 4 times a day. And you are still breastfeeding continuously. So if you're not breastfeeding, then you have to give age appropriate formula. Okay. So so when you're making things like pap, you can add eggs to it. You can do your cereal and put banana into it. So make it like a smoothie. You have to make sure that at every time your baby is having a meal, there are four, nothing less than four of the classes of food must be there. You must have the carbohydrates, which is the pap. You must have the protein. It could be the egg. It could be the fish. It could be, your beans can go in and all that. But most of these beans, you are doing like milk. So it is not really the proper protein. Then you can have your fat and oil, maybe just 1 spoon of palm oil. It's okay. You cook it on fire. Then you can add, your fruits or your veggies, you can give that as a snack in between. You can give maybe a banana, and 8 months old, they can start, doing that, things like that. Or maybe in the afternoon, don't give the same kind of food again. You can decide that this afternoon, maybe you can make the potato, you add a little bit of butter to it, you add a little bit of your crayfish to it, and you mix it together like a porridge or like a porridge, and then you can feed the child with a spoon. And please don't no bottle feeding. Everything has to be thick porridge or mashed food, and it has to be given with cup and spoon. Just if you do that well, your baby will gain weight. There's no way. And if you're doing all that and your baby doesn't still gain weight, then that means there may be an health issue, and that is where we now need to come in and see. But I just think if you need more support, our dietitian can help you with that. They can actually help you work out all of the quantities and the qualities and all those things that we've mentioned. So that's the job of our dietitian. Okay. All right. Okay. So if your vitamin A is 25,000, so you should only give two. You should only give two for your 6 months old. I know your baby is now here. I just give two for now. So be careful. I think when your baby is 1 year, you can give four. So don't overdose. Sisi Oge, thank you for can I give my 4 month old neophenic cough syrup? No cough syrup until after 1 year. No cough syrup. Your baby have cough, catarrh, and it's more than 2 weeks, you have to go to the hospital. No cough syrup. Yes, I know. It's already past 2 weeks. I know what we said. So if it's already past 2 weeks and maybe it's still coughing, it is become what we call chronic cough. Any cough that is more than 2 weeks is chronic cough. It has gone beyond normal everyday acute cough. So you have to come and see us in the hospital. We need to check the chest. We need to be sure there's something else going on. Most cough should not last more than 2 weeks. So if it's going more than 2 weeks, we need to see the baby. And don't give cough syrup, please. Cough syrup is not written anything. Cough syrup is supposed to it just suppress the cough, really. You just like having fever and you give paracetamol. If the child has malaria and that's what is causing the fever, giving paracetamol is not going to cure the malaria. It's just going to make the fever go away. The fever will still come back. So that's exactly what cough syrup do. And for children, we need them breathing. And sometimes some of this cough syrup, they suppress their breathing. And when children don't breathe, we are worried. Because we worry more about children when they cannot breathe, because in cardiac arrest for children, it is the breathing that goes first. If the breathing is gone, that's it. For adults, it's the other way around. It's the heart that goes first. So we always want children breathing. We don't want anything to suppress their breathing. We don't want anything to let them cough. Let us know there's something there. That is why you don't give cough syrup. So if you give cough syrup now, you will think the cough has gone, but the infection, whatever is causing the cough, is still there. But if they keep coughing, then we know it's still there. Then you come to us, and then we can treat it. And that is how we miss pneumonia. And that is how some of our children die from pneumonia, because we are giving them cough syrup. We're not taking them to the hospital. Cough syrup is not going to treat pneumonia. It's not going to take care of it. It's antibiotics. So which is why we don't want to give cough syrup. We don't want to suppress their cough. We don't want to suppress their breathing. we want to know that they are sick coughing. We want to know why they are sick coughing, and we want to see them in the hospital so that children should not be dying from pneumonia anymore. It's going to be Pneumonia Day very soon. So we'll talk more about that. All right. Okay. So I think I've answered your question. So yesterday, say what snacks can you give? Healthy snacks, fruits generally. Give them banana, things they can handle in their hands. You can cut it into pieces. You can make it into smoothies. You can give them, your baby is almost 8 months old. By 9 months, they should be able to handle food in their hands. Things like that is what you can give them, as snack. And give them boiled egg as well if she's able to eat it, but you have to cut it into tiny pieces because your baby's age. So those are the little things you can give. The same, almost of your fruits and veggies can be given as snacks, not biscuits, not not the usual stuff that people think they are snacks. So we wanted this. Now we have a whole list of snacks on our Facebook. If you go to that guide section, all this information are there. All right, my time is up. I got to go. All right, what I'm just going to say is that if you still have questions, please go to Ask the Pediatrician Facebook group. You can't miss our group on Facebook. Just put Ask the Pediatricians. If you see the one with over 700,000 members, that is our group. Okay, because we have a few groups that look like our own, but they're not our own. So make sure you're in the right group. You will see our posters there and everything. Anyway, so go there. You can post your questions there. Mondays to Saturdays, we will answer. Please be patient with us. Don't tell us, I've posted my question for 2 hours, I've not gotten an answer. We don't do emergency. We are not on call. So if you have any emergency questions, you have to come to the hospital. Okay, we will see you. We'll be waiting for you in the hospital. So, but if you just want to learn, like, how do I feed my baby? Is it this one? Is this one okay? Is that those kind of questions? You can post it there. Please, if your child is sick, go to the hospital. Sick children have to go to the hospital. Even the Bible said that those who are sick, they need their doctors. So it is confirmed by the Bible. So if you are sick, you have to go to the hospital to see your doctors. So, but if it's just general health information, education, you are welcome to post on our Facebook group and we will try and answer your question. I know we always say between up to 72 hours, but most of the time we answer your question within 24, 48 hours, so please, we don't have a WhatsApp group. We only have a Facebook group. We don't do WhatsApp. WhatsApp is only those who want to come and book appointment, because some of you will come and ask a question on WhatsApp. Of course, you will notice that we don't answer it. So post your question on our Facebook group. If you look at the thing that is scrolling through under my screen now, it's telling you where you can post your questions. So that's our Facebook group. WhatsApp is our official line for those who want to book consultation with our pediatricians. And please, consultation is not free. Consultation, you pay for it. Doctors are by law expected to collect their consultation fee when you see us for consultation. So it's a law behind it, so we can't do it for free. But when it comes to online education, if you, no matter how many questions you ask us on our Facebook group, we will answer it and won't collect a dime from you. But once you come to our WhatsApp and you want to talk to one of us, that is now a consultation, because we're now dealing with you one-on-one with one child and we're asking you questions back and forth. We're seeing your child either on video or whatever. So that is a consultation, and that is by law. You have to pay for it because that is when your contract is valid. Okay, so just by the way, so please post your question on Facebook. If you're just coming online and you're just watching me and you say, oh, I've missed the program, not to worry. You can actually watch this video again. Watch everything from beginning to the end, because somebody may have asked your question, so you will see get the answers. But if after that you still have question, please go to our Facebook group and Ask the Pediatrician Facebook group. Post your questions there. For the adults, we also have ATP family. I'm not an adult doctor, I'm a pediatrician, but for those we have adult doctors who can answer your own questions as well. ATP family is where you post. We also have first time mothers group. We have our ATP civil mom for those who have suffered pregnancy loss or baby loss and they just want that support, we also offer a group for you. So thank you so much. We try to do a teaching on Thursday. I know I've not been consistent because life has been busy, but hopefully we'll resume that as well. So, but if you want to listen to all our past teaching, like somebody was asking about autism, I doubt there's any topic we've not talked about on ATP. You want to know about immunization, about cough, about fever, diarrhea, pneumonia, name it, we have talked about it before. So please subscribe to our YouTube channel, our podcast. Go listen. Please share. Let's spread this message. Our goal, our vision on ATP is to see no child die from what is preventable. That's what we're working with. We want to get to that day where nobody will be dying from things that we can treat, from things that we can prevent. So that is what we do on ATP. So we look forward to seeing you on our channels. Follow us on all our social media platforms: Facebook, Instagram, YouTube, TikTok, everywhere we are there, Twitter. Follow us, and then hopefully together all our children will be alive and well. So thank you so much for joining me this evening. Thank you so much for your questions. Thank you so much for your time. And I hope to see you again next week, Monday, God willing. And till then, bye. Bye bye. Bye bye from me. Bye.